So we were talking about this mastoid sinus. So now when the patient has a recalcitrant mastoiditis, incurable diseases, now surgical methods have to be instituted in order to treat such conditions. So what they can do is they can do a simple mastoidotomy, an incision into the mastoid antrum. Okay, so we have various types of mastoidotomy and mastoidectomy. Here it would be like a simple mastoidectomy where just entering into the mastoid sinus. A complete mastoidectomy, here what happens is the entire mastoid sinus is being cleared. All the air cells are being removed because of chronic mastoiditis, and then the posterior wall of the external auditory canal and also some parts of the middle ear might also be affected. Now coming to a modified radical mastoidectomy, what happens here is there is a complete removal of the mastoid sinus plus the affected bones. Say for example, the patient has a Cholesteatoma of the malleus, which is an ear ossicle. So in a modified radical mastoidectomy, the physician is going to completely remove the mastoid sinus plus the affected malleus. So that becomes a modified radical mastoidectomy. Next case is we have a radical mastoidectomy. Here the physician is just going to remove everything, whether the normal tissue or the abnormal tissue. Say for instance, here we just had the malleus being affected. Now he is going to completely remove the mastoid plus the malleus and plus the incus and stapes, even though they are not affected, and he is going to convert them into one single unit. So please understand the structures that are removed so that we have the different codes for mastoidectomy. As always, surgical procedures are done based on the medical necessities. The patient might be subject to a procedure for the first time, you can report these codes. But when a patient is presenting for complications or for a retreatment, again they encounter a new problem in that same anatomic site, the patient comes back, then we'll have to report the revision mastoidectomy codes. Say for example, the patient underwent a complete mastoidectomy and now he is presenting for a modified radical mastoidectomy. In that case, you need to report as a revision modified radical mastoidectomy, because now essentially the physician is performing a removal of the affected bony structures plus the mastoid.